It's not genetics, this is what the Japanese do to age well, and you should do it too. In Japan, thousands of older people, in their 60s, 70s, and even over 100 years old, still squat down with ease, work their gardens, walk upright without a cane, and live alone in complete independence. How do they do it? It's not genetics, nor magic supplements, nor expensive treatments. The secret lies in 5 Japanese isometric postures, practiced daily, that strengthen the joints, improve mobility, and prevent physical decline naturally. These Oriental postures, simple but incredibly powerful, have been passed down for generations, and today you can start using them to rejuvenate your body, regain your stability, and prevent chronic pain. Stay tuned, because these traditional techniques can change the way you age, and perhaps even extend your life. Leave your name and the city you're watching us from in the comments. Tell us which of the postures you're about to learn you will try today. We'll be reading. In many countries, older people start to lose strength, balance, and mobility as soon as they pass 60 years old. We see it every day: difficulty walking, joint pain, physical dependence. However, in Japan, one of the longest living populations on the planet, the reality is very different. There, grandfathers and grandmothers over 80 years old remain active, upright, and functional. What is their secret? It's not luck, nor miraculous genetics. It is part of a cultural tradition based on mindful movement. Today I am going to show you 5 Japanese isometric postures that are part of their daily life and that are key to preserving mobility in old age, maintaining good joint health, and promoting true active aging. These Oriental exercise techniques, practiced for centuries, not only prevent physical decline, but also strengthen the body from within and help you reconnect with your health naturally. And the best part is that you too can apply them from home, without equipment or gyms. So before we begin, leave your name and the country you are watching us from in the comments. We want to know where your journey begins toward a stronger, more flexible, and longer living body, inspired by Japanese culture and its holistic approach to health. 1. Seiza, sitting on the heels. The Seiza posture is, without a doubt, one of the most representative ways of sitting in Japanese culture. Much more than a simple custom or social etiquette, this ancient position has been practiced for generations in tea ceremonies, moments of meditation, calligraphy classes, and in everyday life. From a biomechanical perspective, Seiza is a traditional Japanese low-impact exercise that activates isometrically several key muscle groups for mobility and balance. By kneeling with the legs folded backward and the glutes resting on the heels, controlled tension is generated in the quadriceps, calf muscles, glutes, and spinal erectors, which are activated to maintain the upright posture. This way of sitting also deeply stretches the ankles and strengthens the knee ligaments, which is especially useful for people who want to maintain knee health in the long term. Studies conducted in Japanese universities, such as Nippon Medical School, have shown that regular practice of Seiza can significantly improve postural alignment, increase proprioception, the body's ability to locate itself in space, and help prevent joint dysfunction in older adults. From a therapeutic point of view, Seiza has been adopted in postural rehabilitation and physiotherapy programs in Japan and other Asian countries for its ability to strengthen the stabilizing muscles of the trunk without requiring dynamic movement. Its practice activates the multifidus and transverse abdominis, essential for lumbar stability, which contributes to reducing back pain in people with postural weakness or sedentary lifestyles. In addition, the light pressure exerted on the calves and thighs improves venous return, promoting blood circulation in the lower limbs, especially in people with poor irrigation or a tendency to swelling. To perform it correctly, it is important to kneel with the knees together, the insteps fully supported on the floor, and the back straight as if an invisible thread were pulling the crown of the head toward the ceiling. The key lies in the passive activation of the core, keeping the shoulders relaxed, and breathing deeply to relax the superficial muscles while strengthening the deep ones. If you are a beginner, you may feel stiffness or pressure in the knees or ankles. In that case, you can place a firm cushion between the heels and the glutes, reducing the load on the joints until you gain flexibility. With constant practice, even sessions of 2 to 5 minutes daily can generate significant improvements in the body's overall posture and joint flexibility. The Seiza posture is not only a traditional way of sitting, it is a powerful tool to improve posture, maintain mobility in old age, and reconnect with a way of inhabiting the body that has sustained the health of millions of Japanese people for centuries. 2. Kibodachi, horse stance. The Kibodachi posture, also known as the horse stance, is one of the most emblematic within traditional Japanese karate. Its origin goes back to the ancient training of the samurai, who used it to strengthen their bodies and develop endurance during long sessions of hand-to-hand combat. Today, this posture has transcended the world of martial arts and is recognized for its impressive ability to develop leg strength, balance, and core stability. Adopting Kibodachi correctly, with the feet well apart, knees bent, hips low, and the back straight, deeply activates the quadriceps, glutes, adductors, and pelvic stabilizing muscles, generating an isometric contraction that strengthens without the need for movement or impact. This quality makes it an excellent exercise alternative for older adults or for those who want to increase their functional strength without joint risks. Studies published in the Journal of Strength and Conditioning Research have shown that isometric semi-squat positions, such as Kibodachi, generate greater neuromuscular activation than traditional dynamic exercises when held for prolonged periods. In addition to its muscular effects, Kibodachi is also a powerful tool for the development of proprioception, that is, the body's ability to perceive itself in space. This ability is crucial, especially with the passing of years, since its deterioration is directly related to an increase in the risk of falls and fractures. In older adults, the loss of lateral balance is one of the main causes of serious injuries, and regular practice of Kibodachi as an exercise for older people has been shown to significantly improve this aspect. When the posture is held, sensory receptors located in the feet, ankles, knees, and hips are activated, sending constant signals to the brain about the body's position. This type of stimulation strengthens neuromuscular connections and improves intermuscular coordination, which contributes to a better response of the body to sudden imbalances. Moreover, the karate Kibodachi stance helps correct common postural imbalances such as knee valgus, knees collapsing inward, since it forces the maintenance of correct biomechanical alignment. To perform it correctly, the feet should be placed at least twice the width of the shoulders, pointing slightly outward, and the knees should be aligned with the feet. The abdomen contracts gently to keep the back upright, and leaning the trunk forward is avoided. If at first you cannot hold the position for more than 20 seconds, do not worry, gradual progression is part of the process. Even holding Kibodachi for only 30 seconds a day can make a remarkable difference in stability, leg strength, and joint health. By incorporating this practice regularly, you are integrating a fundamental principle of Japanese tradition, strengthening from the root to age with autonomy, power, and balance. 3. Niko Ashidachi, cat stance. The Niko Ashidachi posture, or cat stance, is one of the most refined and functional in traditional Japanese karate. Its name comes from the stealthy and alert position adopted by a cat just before it jumps. Far from being only a combat technique, Niko Ashidachi is actually an exercise of alignment, balance, and deep strength that has been used for centuries in the martial art as a method of integral physical development. In this posture, approximately 70% of the body's weight rests on the back leg, while the front foot barely touches the ground with the tip, as if testing the terrain. This asymmetric distribution of weight intensely activates the stabilizing muscles of the ankle, the plantar muscles of the foot, the soleus, the lateral peroneals, the gluteus medius, and the deep core, creating a neuromuscular chain that strengthens and trains the control of the body in space. This posture has become a valuable tool in exercises for feet and ankles, especially in therapeutic routines aimed at the prevention of injuries due to misalignment or weakness in the stride. Recent research in biomechanics, such as that published by the Journal of Foot and Ankle Research, has indicated that postures that stimulate the intrinsic muscles of the foot, like this one, contribute significantly to the prevention and treatment of plantar fasciitis and other overload syndromes. In addition to structural benefits, Niko Ashidachi represents a powerful practice to improve balance in older adults, one of the most important factors for preventing falls, fractures, and loss of functional independence over the years. When the body maintains a posture where the weight is distributed unevenly, the central nervous system is forced to refine its response to stimuli that affect stability. This strengthens the feedback pathways between the foot sensors, proprioceptors, and the brain, improving reaction time and the ability to adjust posture in the face of imbalance. This ability, called proprioception, deteriorates naturally with age, but it can be maintained and even improved through practices like this. Moreover, the strengthening of the foot and calf achieved with this posture helps stabilize the base of the body, making walking safer and reducing the likelihood of ankle sprains. For people with flat feet or collapsed arches, this posture represents functional training that stimulates the active lift of the arch, strengthening the internal structures of the foot without the need for insoles or external devices. To perform it correctly, it is important to keep the trunk upright, the hips aligned forward, and the knees slightly bent. The front leg must remain light, almost floating, like a cat about to move. Practicing Niko Ashidachi as part of a daily active longevity routine not only reinforces the physical structure, but also invites reconnection with conscious control of the body. In a society where the feet are forgotten inside shoes all day, this Japanese posture rescues their importance and trains them to support us, with elegance and security, throughout life. 4. Zazen, Zen meditation. The practice of Zazen, which in Japanese literally means seated meditation, is one of the fundamental pillars of Zen and, at the same time, one of the most powerful postures to strengthen the spine, activate the deep abdomen, and calm the mind. Although at first sight it may look like a passive posture, Zazen is actually an isometric exercise of high postural demand. By sitting with the legs crossed, ideally in lotus or half-lotus posture, and keeping the spine perfectly aligned for a prolonged time, all the stabilizing muscles of the trunk are activated: the transverse abdominis, the multifidus, the spinal erectors, and the pelvic floor. This sustained activation deeply strengthens the spine, corrects postural imbalances caused by hours of sedentarism or poor positions in front of screens, and improves the postural endurance of the muscles that keep the back upright. The chin slightly tilted downward and the soft gaze contribute to an ideal alignment of the head, avoiding cervical tensions. From a biomechanical perspective, Zazen is considered a model of structural balance. No part of the body should be rigid or collapsed, but suspended in tonic and relaxed equilibrium. This conscious focus on the body transforms it into a powerful therapeutic practice for people with chronic low back pain, since it strengthens without impact, improves body awareness, and restores the stabilizing function to the deep muscles of the back. But Zazen is not only physical, it is also a deeply transformative tool at the physiological and emotional level. When practiced with conscious breathing, slow, diaphragmatic, and nasal, it activates the parasympathetic nervous system, responsible for rest, digestion, and cellular regeneration functions. Scientific studies conducted at Japanese universities such as Tohoku and Kyoto have demonstrated that sitting in Japanese meditation for just 10 to 15 minutes daily produces a significant reduction of cortisol, the stress hormone, while increasing heart rate variability, a physiological marker associated with greater emotional resilience and longevity. Moreover, Zazen improves cellular oxygenation thanks to more efficient breathing, which has direct effects on metabolic and brain health. This practice has been associated with improvements in attention, emotional regulation, and sleep quality, and has been used as a complement in treatments for anxiety, depression, and psychosomatic disorders. Even at the immune level, frequent meditators have been observed to present higher levels of immunoglobulin A, a key defense against infections. For those who cannot adopt the full lotus posture, sitting on the floor with crossed legs and using a firm cushion under the pelvis already offers most of the benefits. The important thing is to keep the back active but without tension, allowing the mind to calm and the body to regenerate from within. Practicing Zazen as part of a daily integral health routine not only strengthens the physical structure, but also offers an internal space of silence, self-care, and balance that is increasingly necessary in an accelerated and overstimulated world. In Japan, this practice has been key in the culture of conscious longevity, and today, you too can integrate it to reduce stress, strengthen your spine, and cultivate a clearer, more resilient mind. 5. Shikodachi, Sumo Stance. The Shikodachi posture, also known as the sumo stance, is one of the most emblematic positions of traditional Japanese physical training. Used for centuries by sumo wrestlers, this posture not only represents power and firmness, but it also constitutes an exceptional exercise for the development of functional strength, that is, the strength that truly translates into useful movements for daily life. Unlike a traditional squat, Shikodachi involves a wider leg opening, with the feet pointing outward at about 45 degrees, which generates broader muscle recruitment, especially in the adductors, quadriceps, gluteus maximus, pelvic muscles, and spinal erectors. This position requires the hips to descend between the knees while keeping the back straight and the abdomen activated, which forces the trunk to stabilize and balance to be worked intensely. Biomechanical studies conducted by the University of Tsukuba have shown that Shikodachi activates more muscle fibers in the lower body than many variants of the conventional squat, including those with external load. This is due to the wide hip opening angle and the isometric nature of the posture, which generates constant muscular tension without movement, strengthening the slow fibers responsible for stability and muscular endurance. In addition to its strength benefits, Shikodachi has a profound impact on improving hip mobility and preventing falls, especially in older adults. One of the main risks of aging is the loss of joint mobility, particularly in the pelvic region, which directly affects the ability to walk, squat, stand up, and maintain balance. The sumo stance effectively works hip opening, which releases tension in the flexor and adductor muscles, improves sacral stability, and allows greater range of motion in daily activities. From a functional perspective, maintaining the position in Shikodachi stimulates joint mechanoreceptors and proprioception, which reinforces the mind-body connection and improves the neuromuscular response to sudden movements or imbalances. This posture also strengthens the deep abdominal muscles and pelvic floor, essential components for healthy posture and stable gait. For these reasons, Shikodachi has been incorporated into Japanese longevity exercise programs, especially in rural regions where the elderly continue performing physical tasks without losing independence. To perform it safely, it is important to start with a comfortable leg opening and lower the pelvis as far as possible without losing spinal alignment. Progression can be made according to each person's strength, beginning with 30 seconds and increasing progressively. Practicing this posture regularly can transform not only your lower body, but also your perception of the body, giving you back security, control, and physical power at any age. Shikodachi is not only a martial pose, it is a comprehensive tool of prevention, strength, and longevity that has stood the test of time for one reason: it works. As you have seen throughout this video, healthy aging in Japan is not the result of superior genetics nor of secret formulas. It is the fruit of a culture deeply rooted in mindful movement, body discipline, and connection with one's own health. Instead of waiting for physical problems to appear, the Japanese incorporate daily simple, natural, and accessible practices that promote healthy mobility, functional strength, and active longevity. These 5 isometric postures, Seiza, Kibodachi, Niko Ashidachi, Zazen, and Shikodachi, require no equipment. Their movements are not aggressive to the joints, and yet they have a profound impact on quality of life. It is a Japanese routine based on muscular balance, postural control, and prevention, and it is applicable to anyone, regardless of age or physical condition. Current science fully supports these methods. Various studies in sports medicine and aging physiology have shown that isometric exercises, when performed in a controlled and regular way, improve bone density, strengthen connective tissues, reduce chronic inflammation, and increase the body's functional capacity over time. These traditional postures not only work the body, but they also offer a space to recover body awareness, mindfulness, and self-care. In a fast-paced world where we spend hours in front of screens and live under high levels of stress, the act of stopping to breathe, activating the deep muscles, and aligning the posture represents a form of active and healing meditation. Exercises such as Zazen and Seiza, for example, have been studied for their ability to reduce stress, activate the parasympathetic nervous system, and promote cellular regeneration, which has positive effects on mental, immune, and metabolic health. By integrating these Japanese postures as part of your daily routine, you will not only improve your physical strength, but also your ability to concentrate, your emotional state, and your relationship with the body. This is where the concept of functional exercise and integral health makes sense, moving not to look better, but to live better. And you do not need to spend hours training. With only 10 to 15 minutes a day dedicated to these postures, you can begin to reverse years of sedentarism, relieve joint discomfort, and regain stability, flexibility, and vital energy. Now it is your turn. Which of these postures will you try today? Leave it in the comments, we want to read you. Will you start with the strength and balance of Kibodachi? Or with the deep calm of Zazen? Maybe Seiza will help you improve your knee health, or Niko Ashidachi will be your ally to correct your stride and prevent plantar fasciitis. We invite you to choose one of these postures and practice it for 1 week. Just one. Observe it. Feel how your body responds. With each day, you will notice more control, less pain, more energy, and greater awareness of your movement. This is how real change begins, from the simple, the constant, and the conscious. Japanese traditions do not propose instant solutions, but sustainable habits. And you too can build a longer, stronger, and fuller life, starting with one small daily action. Because aging well is not a destination, it is a practice. You do not need previous experience nor to be as flexible as a yogi. Start little by little, with short sessions of 30 seconds to 1 minute. Use cushions, lean against the wall, or adapt the posture according to your level. With time, your body will adapt, and the benefits will become evident. Do not wait until pain, stiffness, or fatigue become a normal part of your life. Today you already know that there are simple, effective, and ancient alternatives that can help you keep your body young, strong, and functional, without the need for machines, drugs, or extreme training. These Japanese longevity postures are an invitation to reconnect with your body, strengthen your joints, and gain vitality through mindful movement. Remember, what you do every day has more power than what you do once in a while. A daily mobility routine, even if short, can transform your overall health more than you imagine. Subscribe now if you want to keep learning how to cultivate your well-being with Oriental techniques, impact-free exercises, and knowledge based on the science of movement. Here we share real tools to live with more balance, autonomy, and fulfillment, regardless of your age or physical condition. And if this video inspired you, do not leave without watching the one now appearing on screen. There we show you an ancestral Asian posture that millions of people use to reverse years of sedentarism and recover health from within. Thank you for staying with us until the end. May God bless you and give you the strength to continue this path of transformation toward a stronger, more mindful, and longer life. Your body will thank you. Leave your name and the city you are watching us from in the comments. Tell us which of these postures you will try today. We will be reading.